It is so nice to have you here today. You can sit wherever you feel comfortable. You can sit on the couch or the chair. I do have a blanket for you there so that you can be comfortable. If you feel a bit cold, you are welcome to use it. So I am Dr. B, and I just want to let you know that this room is confidential. You do not have to worry that anyone will ever know what happens here. You are safe here. Okay, so I just also want to tell you, because this is our first session, this will be our intake and just a little quick assessment session. This is just a quick check and just how your mental state is, and then I can also get an idea of how you see the world before we continue with our in-depth assessments or our in-depth sessions. Okay, so I'm just going to make a few notes so that I can keep track of everything. Okay, so let me just okay, so I just want to tell you a few important things. So firstly, you can skip any question if it makes you feel uncomfortable, and you can also ask me to pause if you do not understand something. Okay, so if you want me to skip a question, you can just say pause. Okay, how does that sound? And you can take your time to answer the questions. There's no rush here. Okay, so firstly, tell me, how are you feeling as you have been walking in here today? That makes sense. Thank you for telling me. This is just a orientation checklist. It's not a test or anything. Okay, so can you tell me what day it is? Okay, that is perfect. And is it evening or morning for you? Okay. And do you know where we are right now? Okay, perfect, good. You are definitely here and present with me. Now let's do some grounding. So tell me 3 things that you can see in this office. And the light. Okay, perfect. And 2 things that you can hear, like my voice or something outside perhaps. Okay, perfect. And just 1 thing that you can feel, maybe the blanket or the chair. Okay, that is perfect. You are definitely present. So now we will just be moving on to your mood and your sleep and your stress. Okay, so I'm just going to ask you a few questions. There is no right answers. Okay. on a scale of 1 to 10, with 1 being the lowest and 10 being the best, where has your mood been this week? Okay, that's wonderful. And sleep. How many hours are you getting most nights? So, is the hard part falling asleep, or staying asleep, or perhaps waking up too early? That sounds exhausting. You are handling a lot. And what has been the most stressful thing lately? Okay. Thank you for trusting me with that. That is it. So when it gets like that, what is one thing that helps you cope with that? It can be anything, even if it's just for 5 minutes that you do. Those count. So you already have some tools to cope with your stress. That is a really good thing. So now I'm just going to do a little, I don't like to call it games, but it's something like that. So once again, there's no grade or something like that. It is just so I can understand how your mind is working. Okay. So I'm going to say 3 words, and I need you to just hold it in your memory. Okay. So, apple, penny, table. Okay. You have that. Now just hold it. We are going to continue and we'll get back to that. So now count backwards for me from 100 in 5, like 5. So 100, 95, 90. That is great, you are doing great. Okay, wonderful. Now, spell gloves for me backwards. Okay, that's perfect. So now, can you tell me what those 3 words were that I said to you in the beginning? Apple. Great, that is perfect. So you got them all. It is not an easy task. Okay, so now I'm just going to do a little visual test. So once again, this will help me understand what is going on in your mind. Okay, So I'm going to show you ink blot images. Okay, so I'm just going to show you these images, and I just want you to tell me, what do you see? Okay. So I'm going to explain it now. So here is one image. Can you tell me perhaps what was the first thing that came to mind when you see this? That makes sense. And what it is that they are doing. Okay. I will be moving on. You can take your time. Can I perhaps bring it a bit closer? Yeah, I see that too. Okay. That is perfect. You did great. No need to be stressed about anything. This just helps me understand how you see the world. And I must say, I like the way you see the world. Okay. So now, is it okay with you if we do just some small physical checks? Okay, that's fine with you. Okay, so I'm just going to put on some gloves. So this is nothing scary, and remember, you can say no at any time to any of these, okay? Okay. So first off, can you show me your hands? Palms up, like this. Okay, thank you. And now turn them over. Let me have a look. Okay, thank you. So now I'm going to use this light. It is a bit bright, so I will try not to shine it directly into your eye. So can you just look at my chin? Okay. Look here. So your pupils are responding. So now can you just look up for me? Look up. look down. Okay, that is wonderful. You can blink now. Your eyes are doing exactly what it should. Okay, so now can you smile for me? Okay, good. And raise your eyebrows like you are surprised. Okay, that is good. Now put your arms out with your palms up like this. And close your eyes. Close your eyes. Okay, good. That is perfect. So now just wanna quickly check your heart rate and your breathing. Okay, it'll just be okay, so breathe in. Okay, and again. Okay, and again. Breathe in, hold it, and let it out. And again, hold it, and let it out. Okay, that is perfect. So I just need to see if you have some anxiety or are you calm. Okay, so now I just want to do a quick sensory skin check. So I have this cotton pad and I am just going to brace it onto your skin on your face, but I also have like a sharp point and a soft one and this one. So I just need you to tell me if I'm touching with the softest side or the sharpest side. Okay, so you need to close your eyes with this one. Close your eyes. Okay. Yes, I'm just doing different areas. Okay, that is perfect. Okay, so we are basically done with your initial intake assessment. So now I'm just going to help you regulate and relax a little. I'm going to give you some exercises. You can also do this at home if you feel a bit tense or stressed. Okay. So you can get comfortable and relax. Okay. So on my my voice, we will do something to tense up and then release it. Okay. Put your shoulders up like this and tense it up, and release. Okay, let's do it again. Put your shoulders up and release. Now, put your hands into a fist. Make a fist with your hands and squeeze it and release. Squeeze it again and release. Okay, one more time. Squeeze and release. Okay, now clench your jaw and release. Clench it again and release. Okay, another last time and release. So you can basically change your muscles, maybe your arms, your legs, any part of your body. You can do this exercise. So you tense it up and then release it. Tense it up a bit and release. And this will help you regulate your mood and the stress you're experiencing. Wow. You can make your next appointment at reception. It was wonderful to meet you, and I am excited for our sessions going forward. So next time we will dive a bit deeper in anything you might want to talk about. Okay, it was wonderful to have you here with me today, and I will see you again.